Hi, everybody. I'm Dr. Kara Fitzgerald, and I am here in our Sandy Hook, Connecticut clinic. And our Director of Nutrition Programs, Romilly Hodges, is in our Zurich, Switzerland office. We are a fully virtual practice. Well, actually, we have a small brick and mortar footprint here in Sandy Hook, but we work around the globe. So I'm going to turn it over to Romilly, and we're going to jump in and tell you how we do it.
Sure, Kara. Hi, everybody. So we have a couple of tools that we really rely on in order to make this all work for us. And the number one tool, I would say, is our virtual meeting software. So we have, there are HIPAA compliant virtual meeting software options available if that's something that you're looking for. We make sure that it's sufficient for us to be able to host all of our team. We use it also in our education programs with many, many participants who join us for that. And we share screens, share documents, use the chat feature. All of those things are really crucial, wouldn't you say, Kara?
Absolutely. And when she says many, many participants, that can be into the hundreds when we decide to go live and invite people in and share with them. We do teach-ins in our clinic immersion program, and we'll bring in expert thought leaders, or Romilly and I have done live webinars on programs that we offer, like our methylation diet and lifestyle. And of course, all of our in-house clinic rounds meetings are on a virtual platform, and we have people joining us there as well. So we lean heavily on these programs, and we use them. We just use them to their fullest extent.
And for clinic consultations as well, right? So we have them available for that too. And then I think the second bucket of tools that we use is our chat tools, separate to the meeting software. But we have a couple of lines that we tap for that. So one is an internal team chat tool that just helps to take our emails out of the loop, because inboxes can really quickly get very overwhelmed. And when you're working with a large team, this just helps to organize the information and make it more accessible. And then we also have a chat tool that we use for our educational programs, and that's through a social media closed group as well.
Yeah, and again, they work great. We've got lots of active dialogue content that will eventually become certain best practice approaches, so we can refine ideas that we're thinking about, diets that we're designing, recipes that we're working on. We can talk about new supplements that we're thinking about, the research, whether we've looked into how they're manufactured, et cetera, and their quality control things. So we use these features from very simple conversations to fairly evolved multi-member conversations, and everything is private. We always de-identify, so when we're discussing patients, everything is de-identified, and we might use our good old-fashioned phone for conversations as well. But for the breadth of what we're doing here, from one-on-one patient care to large conversations, both of these tools are effective for us.
Yeah, and I guess it's also a good point to mention that when we set this up, obviously, then as we thought about policies that we developed for working with patients, working with educational program participants, working with team members, that those policies were all reflective of the environment that we established, and online communication and accessing health information remotely. So that all had to be thought through. And then I think
we can maintain HIPAA compliancy in this structure.
Perfect. Yeah. And then I think the last area to mention is in terms of how we do supplement fulfillment, because we don't have a large office footprint. So maybe you could explain a little bit more about that.
Yeah, we do. We've got practitioners across the globe and delivering patient or client care remotely. And, again, we have some folks come in office, but that's the minority of the amount of people that we have contact with. And so our supplement system, obviously, well, our supplement and our labs, if we're ordering specialty testing, they both have to be really user friendly, and we need to be able to access easy drop shipping and reordering methods for supplements. So there are, particularly fabulous tools out there for us to be able to do that. And again, it's seamless in both our brick and mortar setting as well as our remote setting.
So would you make any concluding remarks then about the doability of being able to operate virtually?
While we've been doing this forever, we've always had a virtual footprint. It feels seamless. Our contact with patients or clients feels intimate, important. The therapeutic relationship, I think, is able to be established. In fact, if it wasn't, we wouldn't be doing this. I mean, my entire time in clinical practice, I've had virtual patient contact. And if anything, our tools are becoming easier, stronger, more private, more secure. It's a no-brainer part of the service that we can offer folks.